October is Breast Cancer Awareness Month, and this Wednesday is Breast Reconstruction Awareness Day. And joining us now is Dr. Dahlia Rice, founder of DMR Aesthetics, to talk about what this all means. Dr. Rice, thank you for joining us this morning.
Jewel, thank you so much for having me on today. I appreciate it.
Yeah, absolutely. Okay, so I was just telling you, I had never heard of Breast Reconstruction Awareness Day, and you said that it's been something that has been in motion since 2011. Tell folks more about it, as well as myself.
Correct. So since 2011, we recognize that a lot of women, only 25%, are actually fully aware of their reconstructive options when they're diagnosed with breast cancer. And so it became a global initiative to educate women and make them aware of their options after breast cancer diagnosis.
Okay, and you said only 25% are aware of the reconstructive options. So what have the other percentage been told in terms of what can be done?
So either they only get limited options, or they don't fully understand their options, and or they may not be offered reconstruction at all. And a lot of it will depend on the region that they're located, because we do have some underserved populations that we know statistically don't get reconstructive options like other locations do.
Okay, and so we're talking about women who not only have had mastectomies, but also you said lumpectomies too.
Correct. A partial mastectomy or a lumpectomy, we also do reconstruction with that as well. That's become more common in the last 10 to 15 years, where we do what we call an oncoplastic reconstruction, where it looks like a breast reduction and the breasts actually are symmetric at the end, so that once the patient undergoes their full treatment, they have even symmetric breasts is the goal.
Okay, and why is this so important for women to be aware of, who, have obviously, if you've gone through breast cancer, that's a traumatic ordeal in itself. It can be, and then having surgery to your breast, that's also traumatic. So why is it so important for folks to know their options?
Yeah, that's a great question. And the reality is that as much as we'd like to not admit it as women, our breasts really do define us. And the studies do show that women who undergo breast reconstruction fully are much more satisfied with their reconstruction. They're happier emotionally as well. It also just helps them feel more whole as a person. And so that does help kind of remove the deformities that occur after those types of procedures, and helps create a sense of well-being or a wholeness, so that they can accept their new body, which I like to call their survivor body, to move on to the next phase of their life, which is to live it to the fullest.
Absolutely. And would you say that since 2011, since there's been more awareness about reconstructive options, have you actually seen, more women seeking your help, seeking the help of other surgeons in terms of reconstruction?
Yes, and I think that has been a huge success. Now we know in the United States, 40% of women are getting breast reconstruction after mastectomies or lumpectomies. So that's a huge success. The other aspect is that, for patients to really be fully aware of that, the breast reconstruction journey doesn't stop right after your initial surgery. And so afterwards, 10, 15 years down the road, you may still need more surgery for your breast reconstruction, and all that is covered as well by the legal system. Insurance companies should be covering those.
All right. Well, Dr. Rice, thank you so much for all of that information and for joining us this morning. And if you'd like to learn more about Dr. Rice, you can visit her at DMR Aesthetics, or visit dmraesthetics.com. You can also find them on social media.